And so at Baylor, I get to work in mainly 3 hospitals. At Ben Taub, I get to serve our underserved communities here in Houston. At Texas Children's, I get to see our pediatric population. And then at the VA hospital, I get to serve our veterans. And even though all of these hospitals are incredibly different in terms of the patients that we care for, there was one commonality among all of them, and it was that all of them had a tremendous amount of firearm injuries coming through their hospitals. At Ben Taub, I would see young boys from communities like 3rd Ward or 5th Ward that were coming into our emergency rooms with gunshot wounds related to homicide attempts or gang-related activity. At Texas Children's, I would see, again, children in our ER that were unintentionally harmed by a firearm that they had gained access to that maybe belonged to their parents or a family member. Sometimes too, I would see siblings were the result of those unintentional injuries. And then I would also see sometimes that children would injure themselves on play dates with each other if they had accidentally found an adult's firearm that wasn't stored properly. And then at the Veterans Hospital, I would meet a lot of veterans that were struggling with the traumas of war, and a lot of them were expressing suicidality. And when I asked if they had a plan, if they were to go through with a suicide attempt, if they had a plan in place, a lot of them said that they would use their firearm. And so this highly concerned me, and I think mainly because of my memories as a kid, and I remember how strong violence impacted my life. I couldn't imagine how strongly it was impacting the lives of people here in Houston. And I wondered if this was something that was reflected in the rest of the country. And when I looked at the research, starting with children, this is a graph that represents all deaths for children in the United States over the last 2 decades. And in 2019, you can see that firearm-related injuries surpassed motor vehicle accidents as the leading cause of death for children in the United States. And it's only going up every single year. And then when looking at suicide and homicide deaths in this country, majority of them are also firearm related. You can see here among each pie, if you look at suicide deaths, homicide deaths in the United States, majority of them are firearm related. And so when I also looked at communities and I tried to see how does this affect communities differently, like how does this affect my communities or my patients who come from communities like 3rd Ward and 5th Ward, are they experiencing this at a higher rate than others? And again, I found that counties that experienced more poverty were also those that were burdened by firearm suicide and homicides. And so I couldn't help but ask myself, why was nobody talking about this? Nobody at my medical school was talking about it, and I didn't really feel like the media was talking about it either. And as a medical student training to be a doctor, I know that I have a commitment to public health. I have a commitment to keeping my patients safe, and I need to give them the tools in order to stay safe and to prevent injury. And so there was no space to talk about it, so I created my own. And I started leading workshops at my medical school and other schools within the state. And in these workshops, I would talk about gun violence as a public health crisis. And I would call to action my fellow students and give them the tools to talk about gun safety with patients. We were being taught how to tell a patient how to store a firearm correctly. So I went and designed a curriculum. And through this workshop, I was telling other students how we can talk to patients about gun safety and safe storage. And along the way, I met another student named Timur, who was equally as passionate as I was. And we went to conferences around the country, and we talked about the workshops that we were hosting. And ultimately, this led to my institution and many others incorporating our workshop into the permanent curriculum at my medical school. And in October earlier this year, our workshop was taught to all second-year medical students at Baylor. And within each workshop, we taught 3 main things. Firstly, if you have a firearm in the home, the ammo should be removed when you're storing it. Secondly, the gun should have a lock on it. And thirdly, the locked gun and ammo should be stored in separate areas. This is how you could prevent a child from accessing a firearm and accidentally injuring themselves. This is how you could put time between a veteran experiencing a suicidal crisis and wanting to take that firearm and take their own life. And so
Joan Davis.
there was data that supported this approach, and we continue to talk about it across the country. But when I talked about it with my own patients, a lot of them said, for example, like at Bentab, I can't afford a lock. I can't afford a safe storage option. And so to address that, I went and collaborated with nonprofits across the country, and I worked with 2 amazing trauma surgeons here in this picture at Bentab, and I secured 7,000 free gun locks for patients in Houston. And working with Bentab and Harris Health, I've been hosting distribution events to hand these gun locks out to patients and community members within Houston. And this work ultimately led to national recognition. Earlier this year, I was invited to the White House Office of Gun Violence Prevention to an event called White Coats at the White House. And here, along with US Surgeon General Dr. Vivek Murthy, I helped declare gun violence a healthcare priority. And a few months later, after this event, Dr. Vivek Murthy would go on to declare gun violence a public health crisis. And it just reaffirmed my viewpoint on the matter that this is public health related, and as healthcare professionals, we have a duty to address it. And so when I came back from DC, I hit the ground running. I felt empowered. I looked into nonprofits that were also working in this space, and I joined the board of directors for a nonprofit called Lock Arms for Life. Here's me at a community event where I pass out free gun locks, continue to talk about the work that I'm doing with community members. And while I'm doing this work, I meet people like this woman here in this picture named Coco. A lot of people that work in violence prevention are people that have been affected by it. Coco lost her son to gun violence earlier this year, and now she's going to dedicate the rest of her life on preventing other moms from experiencing the same type of pain that she has. And then also in my role as a board member for Lock Arms for Life, I get to talk to city council and help prioritize gun safety as a public health matter for the city of Houston. And earlier this year, I worked with my nonprofit, Councilmember Kamen, who is to my right, and then Mayor Whitmire, and I helped pass a proclamation that marked August 20th as Gun Safety Awareness Day in the city of Houston. And so I felt like I had done a lot. I had worked in the education space. I had been increasing education for gun safety counseling among medical students. I had been educating my own patients on how to safely store their firearms. I worked in volunteering. I was passing out free gun locks at distribution events. I was working in advocacy. I had gone to the White House and met with the Surgeon General. I had explored the nonprofit work. But there was one aspect of my work that was missing, and it was research. And I know that as a training doctor and ultimately a scientist, research is what informs solutions, and it's how we address complex problems. And so I wanted to get involved in research within gun violence prevention, but I didn't really have the skills to do so. Even though I had done research in college, I didn't do public health research. I wasn't really familiar with epidemiology, and there were a lot of skills that I needed to have that I didn't. And I looked at other people at my institution that were doing this sort of research. For example, Dr. Cedric Dark, who is an emergency medical physician. I also looked at Dr. Joey Fisher, who was doing research within interpersonal violence prevention. And then also Dr. Peter Hotez, who I'm sure as many of you know, created a COVID vaccine and has helped prevent the spread of misinformation within science. And each of these individuals, they were doing work that I admired, and they were doing the sort of work that I wanted to be doing. And they all had one thing in common, which was extra training beyond a medical degree. And so I started looking into programs that I could potentially enroll in outside of medical school that would give me the skills that I wanted. And I found a program at Oxford that I was interested in, and I circulated the idea among our faculty at Baylor. And I ultimately ended up receiving support from Dr. Peter Hotez, who called me pretty impressive, listed some of my accomplishments that he found admirable, and then wrote a strong letter of support. And this ultimately is what gave me the confidence to want to try and embark on this journey of providing extra skills. And so after Baylor, I am hoping to enroll in a program at the University of Oxford in September of 2025. And my course that I've chosen at Oxford is a Master's of Science on Social Data Science. And so here I'm hoping to obtain those skills that will allow me to do public health research and allow me to have a stronger career in gun violence prevention. But ultimately, my path to Oxford would not be made possible without the support of the Rotary Foundation. And more specifically, a man named Bill Davis. I will try to not get emotional, but my dream of going to Oxford would not be made possible without Bill. Going to Oxford, the cost of attendance is around $80,000. And as you saw, my scholarship to Baylor was $100,000, and that is for 4 years, and that covers every single year of tuition at Baylor. And so Oxford is incredibly expensive, and it is something that I would not be able to do if I hadn't have met Bill, who has helped me get financial support to go on this journey. So Bill, I cannot thank you enough. And so that concludes my presentation. I'm happy to take any questions about my journey and my work that I do.
How much is a gun lock?
A gun lock is around $10. Yeah. So the 7,000 gun locks that I received from nonprofits across the country, they were worth about $70,000.
How soon will you know if you're going, or are you going?
So right now I'm studying for a board exam that I have to take as a part of medical school training. And while I'm doing that, I am simultaneously cranking out applications for both my desired program at Oxford, and then I'm applying to a few backups as well.
What do you hope to do with your training?
So when I come back here, I will apply for a residency in combined training in internal and preventive medicine. And I hope to become a clinical doctor that addresses the immediate effects of violence, while also working at an academic research institution where I can research gun violence and help use my research to inform evidence-based policy.
In our divided society, especially in the United States, you don't go up against the NRA. And the NRA used to do a lot of training about the safe use of firearms and all. And I think we've gotten so separated in one camp saying no guns and the other in the NRA and saying you don't take our guns. How do you think we can break down this divide that is between those two camps?
So something that I commonly say in the workshops where I train other students is that as doctors, this is not really a political matter for us anymore. And when we go out into the general public, we can't approach it as a political issue either for that reason that you highlight. And I think that as physicians, my job is I can't necessarily change the environments that my patients live in, but I can give them the tools to try and increase their safety within those environments. And so I think that doctors tend to be viewed as trusted members of society. And I think that as we are highlighting this issue as a public health crisis and not so much a political problem, that we will gain more support. And the gun locks that I received were actually from a nonprofit that was funded by the NRA. And so I've already tried to help create that bridge, and I'm hoping that doctors can try and strengthen it as we continue this work.
Hard to believe that anybody could afford the gun but couldn't afford a $10 lock.
Yeah, so in Houston, the most commonly stolen item from a vehicle is a gun. And for a lot of my patients that are at Ben Taub, a lot of them may have guns that have been stolen, and they use them for self-protection and live in environments that are full of poverty and poor education. And then they struggle to get access to safe, reliable employment. And then maybe this pushes them into doing work within like drugs or working with gangs to try and create some form of purpose or living. And so I think a lot of them have guns that they probably didn't buy themselves. But by providing a lock, maybe I can help prevent whatever harm they're going to cause with that gun, or if that gun was to be stolen from someone else.
Talk about the city ordinance, having your gun sold. would come free, it's a gun lock. And they can throw it away, but let's say you buy a revolver or something like that, you buy the gun, they'll give you the gun lock, that doesn't cost almost anything. You know, at least it would be around, at least they can use it, maybe make it a city ordinance.
Yeah, so if you go to Cabela's or Academy and you buy a gun, you are going to receive a gun lock with the gun. I think the problem is when the gun is stolen and therefore it doesn't come along with the gun lock. Or people don't really see the importance of locking the firearm. And so there's this disconnect that requires education and counseling. And that's kind of what I'm hoping medical students and future doctors can address, is helping bridge that gap.
A couple of things to help our fundraising. This club contributed $5,000 towards the 45,000 deficit that we're trying to find. And also, we also almost have full provinces away from contributing $5 grand. That's quite nice of them. And I know that I'm trying to get enough conditional pledges before the interviews with the committee on December 7th. So that's going to be the first question that's thrown at her. How are you going to fund between 30,000 and 75,000? And so, yeah, if I can get commitments conditional upon her getting approved, that would be a really good help to answer that question. I know you're going to get.
Okay, well, if there's no more questions, thank you so much for listening to a little bit about my journey and the work that I do. I appreciate it.
Before you go, thank you for sharing your incredible story with us. And I'd like to give you a token of appreciation for speaking with us. It's got our 4-way test on the back of the things we think, say, or do, so you can carry Rotary with you moving forward. Let's give her one more round of applause. All right, do we have any announcements? Seeing none, let's go ahead and recite the 4-way test of the things we think, say, or do. First,
Is it true?
second,
Is it fair to all concerned?
third,
Will it build goodwill and better friendships?
fourth,
Will it be
beneficial to all concerned, service above self.
There you go.
Nobody usually gets.
Feels good. Congratulations.
Standing ovations are rare here.
Thank you.
Oh, yeah, very, very impressive.
Thank you.
Good job.
We did